So I'm going to let Tracy introduce herself and her panel of speakers and ask you to just follow her lead because I'm not quite sure what we're going to get. So I'll turn it over.
Thank you, Laura. So welcome. It's really fun to be here. How many were here last time with Dr. Josh Miller? Very nice. I hope that you found that as exciting as I did. It's always fun to bring in a new surgeon, new face to a community, and we really hoped to be able to capitalize and expand upon what he had talked about, which is as our bones are aging and our joints and our tendons and our ligaments, and he, I think, did a beautiful job of walking through what that looks like, what the options and the treatments are as, things can get progressively worse. So we wanted to follow back and say, okay, if you get to the point where you do have decided with your surgeon to have a joint replacement, what does that mean? Because that's kind of feels like the end step. And so my hope today is that you'll come away having a better understanding of that, and not just understanding what the surgeon does, but the team behind him, how we're going to care for you along that continuum. So our talk today is a joint effort looking at the team care for a total joint replacement. Hope they'll go. So I want to introduce to you today, again, my name is Tracy Moran Patton. I am the Joint Care Program Manager at Kadlec. I have with us today, we have Kara Hitt. Kara is our plane tree coordinator. We're really hoping that Dr. Ahuja will be able to make it. We saw him about an hour ago rolling in with a patient to OR. He knows he's supposed to be here. If he doesn't make it, we'll pinch hit a little bit. He may be able to come at the end. We have Susan Witt. She is also a registered nurse. She's our OR coordinator in the emergency or the operating room. Leah Snyder is a charge RN on surgical floors. She teaches our pre-op class, and she also helps care for patients on the floor and direct the teams that do. Brad Lemon is a social worker, one of our case managers. We also have David Lershaw, is that close enough? A physical therapist. And Shannon Hodge is an occupational therapist. I hope you're as excited as I am to have all these people here to kind of talk about this. So, what are we going to talk about today? We may not get to all of it because I really want the focus to be on the team and their role and what they're doing to help support your safety, your comfort, and your best experience as you go through a joint replacement. But I do want to talk really quickly about some national projections. Why are we even talking about joint replacement? Who is Kadlec Joint Care? Hopefully you're starting to see some information out in the community about that. And again, what to expect with a joint replacement from decision through the surgery and recovery. And then again, how are we improving? What are we doing to make it a better experience, not just for you, but for the people that are coming after? So why focus on joint replacement? We know that in 2010, that 7.2 million Americans are at that point, and that was 10 years ago, almost, 5-6 years ago, living with artificial knees and hips. 4.7, the majority are knees, and about half of those are hips. What was really interesting to me, I didn't know, that's 1.5 times the rate of heart failure. Who thought of that? And as of 2015, this is the #1 diagnostic-related group. What does that mean? That means when we're submitting our claims to Medicare, this is the #1, and it accounts for almost 5% of all care episodes. It gets a little bit more exciting because the projections are pretty astounding in that right now we're sitting at 2015, which is right here, And what the experts are anticipating is within 30 years, we're going to be tripling those numbers as far as the demand for total hip and total knee replacement. Whoops. So, you know, who is Kadlec Joint Care? Essentially, our goal is to advance the very best surgical care, your recovery experience, and long-term outcomes for joint replacements. And bottom line, we're here to help you get back to doing what you love. So one of the things that I like to talk about is, so how do you get there? How do you become the best? How do you become world class? And so we've put a lot of effort into this. And so we had to kind of define, what does our program look like? And what we really had to center on, of course, is your individualized care and also the care for your care partner, because it's a team effort when this happens. We also knew that we had to get together a dedicated interprofessional team that we are very excited is led by experts, very skilled physicians. And we just don't have a surgeon, we also have anesthesia, and our hospitalists are represented. And we've included practically everybody on this team, and you can see some of them here. Peri-op leadership, we have also representatives from even finance, from our public relations, diabetes, our nutrition experts. So we couldn't brought everybody today, but we did bring the people that you were most likely to come into contact with. And then there's a lot of focus right now on joints, and you can tell because of the projections, everybody's paying attention to this. We wanted to know who's doing it best and how can we be a part of that. So we've actually joined some initiatives, one of them being the Institute for Healthcare Improvement. They have a joint replacement learning community that we have been working with for the last year. 34 national, international organizations. We're actually the third smallest, and are really working together with the physicians, again, with the clinical team, with the finance, say, okay, how do we improve care? Where is it going, and how do we get there sooner? We are also really excited that we are now part of the American Joint Replacement Registry. And why that's exciting is now we can start to develop, be part of a national data repository that is de-identified. Your information isn't there other than the implant that you had, the surgeon, the procedure type. We're going to get more and more data as that goes along, but really the procedure, and I think Dr. Miller alluded to it, the implants really haven't changed that much. And why is that? It's because we don't have good information about how well our patients are doing. This will allow us to be a part of a national initiative to really track how patients are doing with a particular implant, and hopefully that's what's going to drive improvement. So that's really, really exciting to be a part of that. We have been involved in Plaintree for, 10 years now, and Carol will speak to a bit about that. If you go and you look out on Medicare, .gov hospital compare, you can start to see how we're doing as compared to other facilities. Also, Leapfrog Group is actually the private insurers. Medicare are federal insurers. And then we're really excited, as of 2013 in November, we were able to attain Joint Commission Gold Seal of Approval for our total hip, our total knee. We're really working toward our shoulder and our hip fractures. So that's what the gold coins were about on the back. They didn't turn out quite as we had hoped, but you'll see both Kadlec and then the joint seal of approval. And to speak a little bit more, it's a little bit of a reiteration, but again, we have to be able, it's a very rigorous survey. It happens every 2 years. There's a 1 year in between that we have to be able to speak with them over the phone. But they visit our site every 2, and the things that they're really looking for, are we focusing on patient and care partner-centered care? Do we have an interdisciplinary team that's driving that care, looking at continually improving? Are we advancing best care practices and really focusing on value? And some of the things we'll talk about hopefully today is I think some really exciting things about how we optimizing patients before they even go into surgery. Multimodal pain management is a big deal. We want to keep you as comfortable as possible. There's lots of new advances in that. Rapid recovery, I think David and Shannon will speak to. You get up the day of surgery because we know that you'll do better if we get you up sooner. It seems counterintuitive, but that's what all the evidence is saying. We also have always focused on preventing complications, and of course we have to be responsible and look at how we're limiting our cost at the same time that we're improving. And then again, we have made a real conscious decision about being very transparent about our data, what we're doing. Right now, again, you can go to hospitalcompare.gov. You can see data from everything and everywhere. Have you all looked at that? It's pretty exciting. Now, you're going to need to understand, though, it's about 2 years old. So, because it's the federal government, we don't move quite as quickly. So that's kind of fun. So we'll share some of that. But we really want to be able to put it out there because you deserve to know. If you just decide to Kadlec, if you come with this particular surgeon, how are we doing? How are we improving? Can you show that you're improving and trying to make it the best for us? We're pretty excited. We were the first in the area to attain this and number 6 in the state. So Kara will speak really quickly. We're going to be passing the mic, so we're dancing a bit.
I'm really excited to be here with you. And as she said, my name is Kara. I'm the Plain Tree Coordinator, and that means that I get to do a lot of really great brainstorming and working with our staff to identify and really recognize all of the amazing things that they do on a daily basis. And that's really what we're talking about today, is how we create an experience together as a team that really supports our patients and their family members. And we especially want to make sure that we recognize the importance of those family members, because I know that once the patient goes home, that family member is going to be the one taking care of them. So we try to really create good partnerships from the beginning. So as you can see up at the top, it mentions some of the caring partnerships that we have. Our Care Partner program is something that we've had in place for a few years now, and it allows the patient to identify either a family member or a friend, somebody that's close to them, as somebody that is much more involved in their care. They have some certain responsibilities. They have a few extra rights that they can interact with the care team, but it's really to allow that patient to decide who is important to them and who is going to have access. And as you listen, I want you to be able to hear all of the different things that our care team members are really creating every day, because it's these everyday interactions that they have that are going to make the difference in the long term for you. Our care team is made up of so many different people, and they have made this their passion. They've made it their living, and it doesn't just include the bedside nurse. It doesn't just include the doctor that will come in. As you can see, we're going to have different therapists talk to you today. We have social workers. We have all sorts of people that are going to help to coordinate your recovery and then getting home as quickly and as safely as they can. So working with them, it can really become a team approach rather than just the next person coming into the room, and that's really how we want it to be for you. Bedside report, hourly care rounds, and open medical record is something that we really try hard to do to make sure that when you are here as a patient, or when you're here supporting a loved one as a patient, that you have as much information as you need to be able to be an active participant, because you're the one who's had that much more knowledge. You've had your lifetime's worth of knowledge of your medical care, of your experiences, of what you feel like, and so you really have the most knowledge to share, and so we want to make sure that we capitalize on that and allow ourselves and you to partner together. Those bedside reports allow our nurses to hand care off between one shift to the next, and when they do that with each other in the room at your bedside, it really allows them to be able to interact with you so that you know exactly what's happening. So you see both faces rather than just the next nurse comes in and starts taking over. You really get a chance to interact with them in a team approach, and then you can also clarify or ask any questions at that time that you need to. Excuse me. Another one thing that we have that's really incredible is our open medical record. As you may have noticed, we have computers everywhere today. As we know, we have computers in our pockets, and because we have a pretty incredible electronic medical record, we have computers at every bedside, and that means when our care teams are in there, they're going to be charting at the bedside. And so as they're doing so, they're going to be reflecting on the experience that they're having with you, and they have access to the information right there at their fingertips. Please feel free to ask them questions. That's why they're there, and they don't always know what you need to know. They don't always know what you want to know or what questions that you have for them. So it's really a great opportunity to partner with them and to recognize that this is information that they have and are happy to share it. They just need to know exactly what you're after. we have next on the list is our Kadlec Patient Partnership Council. This is something that we're actually working to redesign and redevelop. This is an ongoing council that's made up of community members that have been patients or have been family members of patients that can really help to allow us to understand whether or not we're meeting the needs of our community and really allow us to bring the voice of the patient and the voice of their family back to what we do. Because as human beings, I can put my patient hat on and I can consider what it would be like if I was a patient, but having worked in healthcare for a number of years, I can't get there fully anymore. I can't fully take off my Kadlec employee hat. And so that's why we really want to interact with our patients and find out, is this meeting your needs? Are these words what you want to hear when I'm trying to make a message? So that's one of the things that we do. In addition to our ongoing Patient Partnership Council, every year we do some focus groups that are specifically geared towards joint replacement so that we can make sure that our program is meeting the needs of our community, that if there are any new advances, that how are we communicating that, and are the educational offerings that we have, are they meeting the needs, and what other things that we can do to improve. Those are something that we have done for the last several years and have had a lot of really good things that we've learned from them. And there's so much to Plaintree. The smallest things are going to be the interactions that you have, which are obviously going to mean the most. But some of the things that you'll experience there too are going to be in the environment, which I have listed next. Some of them are like the quiet kits, because sleeping in any bed except for mine is hard. And so if you are at the hospital and you need to get some extra rest because you're healing, and maybe this is the 5 minutes when somebody isn't coming into your room and you need to catch some Z's, there are quiet kits. The rooms are all intended to have special quiet machines, and they have the different sound, whether it's wind or thunder and things, so that you can actually have a little bit of white noise going on. When you come as a patient and get your admit kit that has like your toothpaste and your comb and things, it also has an eye mask and some earplugs. So there are some different things in it that can help you get a little bit of extra sleep so that you can actually rest while you're here in sometimes what is not always the most restful environment. Warm blankets. We were so excited to hear one of the smallest things that we don't even think about is one of the most appreciated things. At our last joint replacement focus group, not every single group that we had, somebody mentioned how much they appreciated the warm blankets. So take advantage of that, because it'll help relax your body. It'll help you feel warmer and safer, and it's just a simple, small thing that we can do. In addition, we have a lot of really great therapies. Our aromatherapy program can help you to relax. It can help with your pain management, pet therapy, and especially if you have a pet that's really special to you that you may be worried about, or your pet's not eating at home because they're worried about you, your pet can visit. Now, there are ways we have to do this safely so that we can make sure that no pets give birth on was it surgical? That did happen in the past. And so we do ask that if you would like to have your pet visit, that the pet goes first to security with the person who's handling it, and the patient can't be the one who is responsible for that pet. So if you would like to have your pet visit, that's totally fine. We want you to have that pet to come visit, but make sure that we go through the proper channels so that everybody can have a good experience with it. There are also art carts that have different coloring pages and puzzle books and Sudoku and puzzles and things to just keep you from being less bored, because you can only watch Judge Judy so many times before you get bored. And then, of course, additional therapies like massage therapy. Now, some of those need to be prearranged to make sure that we can actually get to you, just because we have a lot of different patients and some of them have to be prioritized. So as you can see, there are a lot of things that happen, and most of the most important things are going to be the ones that happen face to face. And so really capitalize on the experiences that you have with your care teams. Get to know them, get to know their names, because as you know their names, they'll get to know yours as well. Thank you.
So again, we just wanted to represent actually it's a very small few of the people that you can expect to come into contact with. And when we kind of think about who is going to be your care team when you come to have a joint replacement at Kadlec, definitely your physicians, their physician assistants. And again, your physicians not only are your surgeons, your anesthesiologists, you may have a hospitalist on board, but their job is really to perform the surgery, to manage your anesthesia and pain management, as well as any other type of medical care that you might need and your recovery. Nursing actually they're at the front line with you. They're facilitating and monitoring throughout the entire peri-op, your surgical and recovery care. They are ensuring your comfort as well as helping you prevent complications, and we are continually educating. If you know nurses, we educate, and we can't give you enough. So that's, I think, a really fun part of our job to be able to provide for patients and care partners. Therapists will be teaching safe mobility, strengthening, flexibility, balance, help with your daily self-care, everything that we can do to keep you safe as you transition home. Case management is going to ensure your safe transition and that you have access to the resources that are available to you. They're your right-hand man as far as, do I qualify for this, or, where do I get my walk? These are, they're going to be helping you with that. And then our plane tree coordinator who you just met. So to speak a little bit, bottom line, we're all here for one thing, and that is to your utmost safety, your best comfort, as much, it's a surgery, but we're going to do all that we can to help with that in your healing environment. And we want your optimal outcomes. We want you to be very happy at the end that you got your new hip or your new knee or your new shoulder, and that it's going to last and it's going to really improve your quality of life. And I think it's really interesting, and I think Kara can speak to this too, that as I've been a nurse for over 20 years now, the evolution of care has been so interesting to me. It used to be, we've all experienced it. I think most of us are old enough to remember where care was done to you. We've evolved. We start to feel a little nicer about it. We say, well, now we're going to do care for you. But I think we've come even further now in that we're saying we're doing care with you. This is your surgery, and we're going to partner with you to make sure that it's the best experience. So you can expect, what happens along, so we'll talk about the care continuum a bit. You're going to have that consultation with your orthopedic surgeon, and Dr. Miller, again, covered that very, very nicely. But some things he didn't really talk about you need to know is that this is really a shared decision-making model. So what that means is that you deserve to know what your options are. And you can anticipate that it's going to be least invasive to the more invasive. And that's how it should be. We're going to start conservative first because we want to extend whatever you have left in that joint until you really have to get it replaced. Where they should be talking, they will be talking to you, what are the expected advantages, what might be the disadvantages, and again, what are the realistic expectations from this? If you get a total knee, are you going to be able to bend down on your knee? That's a conversation that you really need to understand with your physician. And then again, what's most important, what's most valued to you? The decision to get a joint replacement for somebody who drives a truck all day may be a different one than one who is caring for children all day long. So it makes a difference as far as where you're at. Another thing that's fairly new, and you can anticipate, are called patient-reported outcome measures. That is where you are providing, and these are standard surveys, where you are filling out a form that's saying, here's where I'm at with my pain, with my function, with my mobility, with my overall quality of life. And then we're going to be capturing that again, usually at about 3 months after, 12 months later, because it's a beautiful tool. One, so that you can see what the difference was, that it's a conversation point now, very objective between you and your surgeon to say, here's where I'm at. So maybe you're having some difficulty with pain at that 3 month. How are we going to help you get past that point? And again, at some point, we're going to be putting this as part of the National Data Registry so that we can see how our patients really doing, because these are the things that are most important to you. And the other thing is that we're really focusing on getting you as healthy as possible before surgery. So you'll hear words like patient optimization. That means we're going to optimize your health. We're going to get you as strong as possible before you have surgery. And so don't be surprised if you're referred back to your primary care provider. If you have a specialist, whether it's for your heart, for your lungs, diabetes, a psychologist, dental even, we want you primed and ready to go. So you can anticipate then also that once you make the decision, that you receive what we call a surgery roadmap. Actually, all of our elective surgeries get a surgery roadmap, but we also provide a procedure guide that's specific to you. And what it does is it walks you through each stage, what you can anticipate, next steps. Once there will be a kind of in the background, there's an insurance review going on, and once your OR is scheduled, that's when we actually kick into action at Kadlec. And you will receive a call. We're going to start to schedule your pre-op appointments. So, and we'll have Leah speak next as far as our pre-op class. Sorry, I switched them. I didn't mean to.
Yeah, so as soon as you make the decision that you are going to have a joint replacement surgery, your surgeon is going to want you to attend one of our community education classes. We hold them every Tuesday for patients who are having knee replacement, hip replacement, and spine surgery. During this 1.5-hour class, it's going to be facilitated by a registered nurse like myself and a physical therapist like Dave over here. And this class, we strongly encourage that you bring your care partner along with you to the class. It's important that both the patient and the care partner are familiar with the things that we talk about at the class. We're going to be going over things that you need to think about before you even have surgery, like how to prepare your home and those other doctor's appointments that you might need to make to optimize your health prior to surgery. And we're going to talk about what to expect, that day of surgery while you're at the hospital, and then those following days in your recovery while you're at the hospital. And then we're also going to go over things you need to think about to prepare to go home. And Dave, you can talk a little bit about what you guys talk about during the class.
During the course of the preoperative class, from a physical therapy standpoint, from a therapy standpoint, what we want to address with you are things as far as what to expect right after the surgery. And I'll probably talk about this a little bit more when I have my slide. But we want to address things with you that you can expect as far as our involvement with your care right after the surgery during your hospitalization. Ultimately, we want to get you moving the right way to help maximize the total joint replacement that you've just undergone. We also like to address with you any considerations or things to think about as far as home, which is something that can be easily overlooked. Obviously, when you return home, you're going to probably be mobilizing or walking with a walker or some sort of assistive device. So you need to keep that in mind as far as how you're navigating around the home, different safety measures, get the real thick rugs out of the way, and to start thinking about those kind of things, knowing that you may be using a walker for a few weeks when you first return back to your home. In addition to that, any questions that you as the individual may have for us from a therapy standpoint regarding equipment you may need or any other measures or things that you need to think about or get in place before the surgery. We like to address those things at that point in time so you're already thinking about those things, and that will kind of, I think, ease the transition as you then go to the hospital and have the surgery completed. Those things hopefully are all in order and you feel comfortable about those things.
Dr. Ahuja is with us. Perfect timing. So this is Dr. Ahuja. He is our director of our anesthesia services.
Thank you, Tracy. Thank you, everyone, for being here. And I apologize for being a little late. Had a car situation, so needed a ride from my wife to get here. It wasn't fun. I'm so glad I made it. Was driving on 240 and just the car stalled down on freeway and so I had to pull over. But, bad things can happen. I'm glad to be here now. Just wanted to give you a brief overview. I may look young, but I've been doing this for some time. There's a lot of concerns that when we talk to our patients before surgery pertain to it's a surgery. We're cutting open things, we're doing things. How much pain I'm going to be in? And if one person in the entire team is concerned about we really are concerned about your pain afterwards, and always are constantly thriving that we can do a lot of the things that our team here, works with you on making sure that you're walking, right away after surgery, because those are very important things where, all the expertise is right here, making sure that if you're scheduled for surgery that you get through, are able to go back home with, be able to do a lot more things that you were doing before you came for surgery. Some of the things that, especially when it pertains to total knee replacements after knee surgery that we started doing is basically numbing your site where you work, where the surgeon's working at afterwards, so you don't have a lot of pain afterwards. And our goal is to make sure that you're still able to walk and not feel the pain. And it's and you can look up, we can share more information with you, but I don't want to go into technical details, but we place, basically, it's a Novocaine block that we place in right here in the middle part of the thigh, it can be either done before or afterwards, right after the surgery. We leave a very tiny little catheter in, which actually delivers Novocaine to your knees, so your front part of the knee where the cut is going to be numb, so you don't feel pain. It's hooked up to a pump. It's automatically delivers that Novocaine round the clock. Those pumps are good for about 4 days, so it's almost 100 hours, which is actually pretty long time for pain control. That's where most of the time our role is. Some of the other things that we're involved as anesthesia providers is when you come in, you'll see us in the morning of surgery. You'll get to talk to one of us. We'll talk over different options with you. One of the things that we always hear from our patients is, I don't want to know anything. And we're thinking in our head, and I'll be very honest with you, we're thinking we want our patients to safely go through this procedure. It's a stressful operation. It's a big operation. It's, a lot of cutting, and we're thinking of your safety. So yes, our concern is that you don't feel anything, but that's not top priority for us as anesthesia providers taking care of you. So there are different options that you will be. So I'm going to briefly touch on different options that you will be offered as if you will be considering that in the future or you are now. One way is to just go to sleep. We call it a general anesthetic, which basically means placing the IV, giving you medication. You're completely asleep. We put a breathing tube after your sleep. You're on the ventilator for about an hour and a half, how long it takes. We take the breathing tube out at the end, and you don't know anything about the surgery at all. The other ways to get this surgery done, especially on knees or hips or even shoulders, is to not go to sleep completely. We can numb part of your body, from your waist down. We've heard of, labor. We heard of cesarean sections that are done while patients are awake, and so they can interact as soon as the baby's born. The mothers can interact with the babies. It's the same block. It just, can be done for any surgery that's below the waist. So that's an option for hips and knee surgeries. For shoulders, we can just numb just the shoulder itself. Those have been shown in our literature, in our studies, to be, I would say, less harmful to the body in terms of recovery times, because we can completely avoid putting in breathing tubes, going on the ventilator by doing that. I know it's a poke in the back. We use very, very tiny needles. We numb your backs real well. I know the concern we hear from patients is, well, am I going to be paralyzed, with the spinal or block? I have not, in 14 years, actually seen one case or one incident even. So it's yes, we talk about it in our literature, but those are very rare circumstances that happened if you're taking, and that's what we look for. We look for you're not taking any blood thinners, so we would not want to do that. So that's not for everybody either. That's where the anesthesia specialist will be involved in, answering those questions. So we kind of briefly touched on some of the things like, we do discussions about various options that are available. Our focus is going to be on, how do we manage your pain afterwards. Believe it or not, our total knee surgeries actually hurt a lot more compared to the hip surgeries. And this is, again, from patients who've had both, talking to them. Because, knee joint is just a lot more involved compared to, in terms of how much dissection, how many tissues they have to work through. I think that's, I don't want to go into too much detail unless you have any specific questions that, if you always have wondered, or I can answer that are related to anesthesia. So currently we do have our nursing staff. That team works very, very closely with anesthesia providers, all of us. And what we do is that's an appointment where you'll spend about 30 to 45 minutes, and we will go over each and every medication with you, which ones you're taking. If there are any questions from our nursing team in that pre-anesthesia clinic, they will actually call us and say, well, we have somebody here, they're taking these medications for these questions they have. It's a very thorough process of, and we see that as a pre-flight check, in terms of making sure that's an opportunity where right before your surgery, all these elements that we need to make sure that you have a safe outcome. We'll go over your medications, your allergies, the past surgeries you've had, if you had anesthetic in the past, if you've had any problems, nausea, vomiting, or some other allergic reactions that we need to know about. That's the whole idea of catching those, before surgery. That's depending on how you approached an orthopedic surgeon. We actually do coordinate care with your specialist. So, for example, 2 or 3 months ago, you had this minor heart problem that you went in for checkup. They did an EKG, and they found out they made you go for a stress test or further workup with a cardiologist. That's our basically goal of that visit, is to coordinate all that care and get all the information in at one point, so that the anesthesia providers, the rest of the team actually knows about you, and it's all entered into our electronic record system, which we absolutely love. I mean, this is on Kadlec. Have this electronic record system since 2011. It's almost 4 years now. And as a provider, even from a patient standpoint, I've received care at Kadlec as a patient. It's very useful because now we have one record. It actually can see through different. So we can see if you went and saw a primary care within Kadlec network, what was the interaction like? What did the doctor say, without having to ask that information of you? We can see your lab tests from all the way back if they were done within Tri-City Laboratories and Kadlec system. So
I think we'll hold questions for the end, if that's okay. Thank you, Dr. Hujas. So that pre-op assessment, or the pre-admission services, definitely includes that anesthesia clearance, as well as any additional labs, chest x-ray, diagnostics that your surgeon would want. And they're also going to go over your pre-op instructions. You're going to get a lot of information, a lot of reiteration with that pre-op instructions. Even the night before, you're going to get a pre-op call before you come to the OR, reinforcing, have you followed your pre-op instructions? And again, confirming your date and time for arrival. And very, very importantly, when they tell you nothing to eat or drink and what medications you can or can't take, no jewelry, don't bring valuables, but do bring your care partner. We mean it. And if you show up and we find out that, that maybe you forgot and you had breakfast that morning, unfortunately, we're not going to be able to do your surgery because it's not going to be safe for you. So just know that the reason we keep telling you these things and we keep reiterating is because it's very, very important for your safety. So Susan is our OR representative. She's going to walk us through.
Hey, y'all. As you notice, I have a little bit of an accent. So I am the OR coordinator, and I'm going to talk to you a little bit about what you can expect for your perioperative experience. And when I say perioperative experience, that's from the time you walk into the doors and greet probably Miss Ruby, our receptionist, and get checked in through the recovery room. So once you get checked in, like I said, typically Miss Ruby is the lady who will say, yep, you're here, check you in. Pre-op will come out and get you and bring you back to a room. This is where they will ask you to put on our lovely little gowns. And they'll get your height and your weight, take your vital signs. They'll ask you a lot of different questions about your history and make sure everything is in order. They will put an ID band on. This is very important because you will get asked probably no less than 9,000 times what your name is and what your date of birth is. We're going to double check your consent to make sure what you think you're having done is what we think you're having done, so we are all on the same page. We're going to go over with you your home medications and make sure that, like Tracy said, if you needed to take something the day of, that you've done it. Like head-to-toe physical assessment, make sure you're in tip-top shape to go back. This is also where anesthesia will come in and ask all of those questions the day of surgery. The surgeon or their physician assistant will come in and put their initials on whichever body part, your knee or your shoulder or your hip, the correct one that we're operating on. The circulating RN is kind of where I come in. I have an OR background. So a circulating RN's job is, one, they get your room all ready to go. They have all of the specialized things that you need for your surgery, make sure that the implants are there and are ready to go, and then they'll come out and have the interview like you've already had before. They'll ask you your name, your date of birth, what you're having done, if the doctor has come in and marked, just so we're all, hearing the same information. So don't be surprised and say they don't know what they're doing, because they're asking me the same thing over and over and over and over. And in pre-op, that's also where they'll clip hair if they need to clip hair away from the surgical site, and they'll give you a special washing and cover it with a towel before you go to the OR. So what will you see when you come back to the operating room? So obviously it's very bright and it's typically very cold, and we understand that. We want you to be comfortable, so we provide warm blankets. We are starting to test out these specialized gowns that have a little personal air blower that you can control your own temperature before you go to the OR. So hopefully you're very warm when you get there. We'll provide warm blankets. We'll provide a smile. We'll be there to assist anesthesia to help you either go off to sleep if you choose a general anesthetic, or help with the blocks. We do have a dedicated OR team. We typically have the same people who are doing these case after case after case after case, so they are very, very good at what they do. There is limited access in the OR, and I just wanted to point out, don't be alarmed when you see people that look like they are from outer space. That is our specialized gowns to help protect you. That is for your safety. We will warm you. A part of my job as a circulating nurse is to prep the surgical site for surgery. We do timeouts before every single surgery. We want to make sure every single person in that room is on the same page. We know who we have in the room, what is being done, if there's any special needs, and so forth. We make sure that you've had your correct antibiotics, that they're in, any other medications that you need in. We have specialized wraps that go on your legs, and it connects to a machine that kind of gives you a little leg massage while you're asleep, and that's for clot prevention. We want to keep the blood flowing through your legs. We perform counts because we want to make sure what we started with is what we ended with. And at the end, we all kind of discuss, okay, so this is what we did, and make sure everybody's on the same page, what medications were received during the surgery, because we all want to obviously still be on the same page. And once your surgery's finished, you wake up or you get transferred back to your stretcher. The circulating nurse and the anesthesiologist will take you to the recovery room or the PACU. Here you will stay until you are fully alert and awake, your vital signs are stable, your pain is manageable, and you don't have any nausea or vomiting. At that point, they will take you to your room, and that's where you'll be reunited with your care partner or your family. They'll be directed to go to your room. We're really here to keep you safe, to keep you comfortable, and to do what we can to make your experience a good one. Thank you.
And while they're taken back to the room, normally the surgeon is updating the care partner before they're going to be meeting you in the room, so they know how well the surgery went too.
All right, so once you're done in the recovery room, you're going to come up to the surgical unit where you'll have your own private room up there on the surgical floor. And of course, we invite your care partner and your family members to come up immediately. And once you first get there, your recovery room nurse and your surgical floor nurse are going to do a bedside report. That we will continue to do that at every shift change or every change in care along your way. We'll do a report right in front of you. So our primary concern right after surgery is we want to make sure that you're medically stable. So we're going to be monitoring you closely for those first few hours that you're up on the surgical floor. And then once you're awake enough, we are going to start off teaching you and your care partners about how to avoid complications. We're going to have those pumps on your legs to help prevent blood clots. We're going to be teaching you little bed exercises you can do to also keep that blood going to help prevent blood clots. We're going to give you breathing exercises to do to help prevent pneumonia. And of course, we want care partners and friends and families who come into the room to be sure that they have good hand hygiene, that they wash or sanitize their hands to help prevent infection. And on that note, I usually tell my patients not to be afraid to make sure that the staff members coming into the room are also, washing or sanitizing their hands, and don't be afraid to, take control of your own health and safety, and make sure people coming into your room are doing that. Now, the main thing that most of the patients are concerned about is your comfort. You've had surgery, and it's going to be painful. Now, we are going to work as hard as we can to make sure that you are comfortable, because if you are in too much pain to do your therapies, you're going to have a more difficult and longer recovery. So it's really in everybody's best interest that your pain is under control and that you are comfortable. And so your nurse is going to collaborate with either your surgeon or the anesthesiologist to make sure that your pain is under control while you're with us. And, we can use medications. We might use repositioning, ice packs on your limb. We even can use the massage therapy or aromatherapy just for general, relaxation that can help you deal with your pain better. But again, we really want to make sure that you're comfortable enough so that you can get up and do your therapies. So, if you have surgery, please communicate with your staff to make sure that you are comfortable enough so that you can, get up and do the work that you need to do to recover quickly. Now, on the surgical unit, you'll see an example here of the care board that we have in every room. And this is a board that we use to communicate amongst each other and also with our patients and our family members. We'll have listed on here, your staff who's taking care of you that day, your care team, your nurse, your doctor, your physical therapist, your CNA. And then also you'll see that we have a section that's labeled your goals. And so throughout your stay, your nurse is going to be continually updating your care board to show what goals we want you to meet that day. And of course, with part of that, as nurses always do, we are always going to be educating you and your care partner on what we need to do to achieve these goals for today. And you'll see that there's green squares and there's red squares. And so when you've met that goal, we will flip that over to a green square, and that means green for go, like you are ready to go home. So if you have met all of your goals, ideally, when all those little squares are green, that should indicate that you have met all your goals and you're going to be ready to go home and continue your recovery at home.
So I'm Brad. I'm one of the social workers on the surgical unit, and my job is to come in and basically do what's called a post-surgical assessment to make sure that you guys have the resources you need to successfully recover from your joint replacements. So I'm going to come in, I'm going to start interrogating you while you're still under anesthesia so I can get all the right answers out of you. But basically I'm going to be looking at your home. How many levels do you have in the house? Do you have stairs to get in? Do you have is your bathroom on the second floor? Who's going to be helping you in the house? Who's going to be driving you to your follow-up appointments, helping you get groceries, doing the cooking? What medical equipment do you currently have? And then I'm going to be looking at the physical therapy notes to see what medical equipment they're recommending. Do you have a walker? Do you have the right type of walker? Some walkers have got 4 wheels, some have got 2, and if they're thinking the 4 wheel is going to be moving on you too fast, they might be recommending the 2-wheel walker. So I'm going to be basically looking at what you've got at home and what we need to get you to make sure you're going to recover properly, and that we're not putting you in a bad spot where you're going to end up, not recovering as quickly. What else do I have on there? Post-surgery rehab. Some people benefit from having a physical therapist come to the house 2-3 times a week. So I'll be working with your insurance and making sure that's covered and that's set up for you. Sometimes people don't need it, or they can go as an outpatient and get physical therapy, and then the doctor will write you prescriptions for that as well. But mostly my job is just to make sure that I work with you and your insurance to identify any needs and then make sure you get them. Okay? Who's next?
All right, so a famous question I like to oftentimes ask patients in the operative class is, okay, so you've had the joint replacement, so now what? So does that mean your knee's fixed and you're ready to go home and get back to your yoga or dance classes or whatever else you want to get back to doing? Obviously the answer is no. There's some individuals that still think that after a major surgery or joint replacement that kind of the best medicine is rest and to stay in bed. While that is not what the research is showing us, we actually are going to start to get you up and moving as soon as we possibly can, as soon as you're medically stable to do so. So we will be involved with your care that same day of surgery. Later in the day, our goal is to start to get you moving the joint. I like to say I'm kind of the first one to get my hands on that joint after the surgery. So a nice warm plate of cookies and some milk on the table, and I'll be extra nice to you when I come and see you. But we really do want to expose that joint, all the tissues that surround the joint, to some motion, some movement. And then ultimately we want to get you on your feet, weight bearing, because when you actually bear weight on your joints and your bones, that can actually help to stimulate the bone structure surrounding the replaced joint, and it will actually help to stimulate healing. So we want you to start to bear weight, to stand, to walk and move as soon as it's medically stable for you to do so. So that's a big part of our roles as we start to work with you after the surgery. We talked about anesthesia, and I can say firsthand, with some of the new things that we've implemented, that a lot of the patients that we see, their pain is minimal to none. So I think a lot of patients are a little apprehensive about having a joint replacement surgery because they think, well, okay, that's fine and well, I'll get the surgery done, but after the surgery, some mean physical therapist is going to come in and make me move my joint around in a stand and walk and move, and it's going to hurt a lot. Well, with a lot of the things that they've implemented from a pain management standpoint and through anesthesia, I can tell you that patients' pain is almost non-existent. And so that's been a great benefit, and it's helped patients tolerate doing more movement and to tolerate walking better. So what that means for you is a quicker recovery, and we'll be able to get you out of that hospital and get you back home where you're going to heal better anyway. The average length of stay is about 2 to 3 days, believe it or not. So we're not going to let you hang around watching Judge Judy for too long there in the hospital, okay? We want to get you moving safely, make sure that everything is set in place for you to return home, but we want you to get out of that place, get out of the hospital, and get home because you're going to recover better there, okay? So, mobility restoration, I put that up there. So if you've had an old bike or maybe a bike that you haven't used for a few years and it's off in the corner of your shop, maybe you damaged the wheel, and so the wheel's damaged, and then one day you're thinking, I'd like to use that bike and get moving on that bike. So you take it to the bike shop, and the bike technician, we'll say the surgeon, replaces the wheel, okay, the wheel mechanism. Is that bike in stand and ready to go? I would say no. There's a lot of other things that need to fall into place. You need to lubricate the gears and the chain and realign the chain and wipe off some of the dust and reposition the seat. So that's kind of where we come into play. The surgeon replaces the joint, but for those people that have been limited for so long, they maybe have been walking with a painful limp. They've been slumped over to one side. Maybe they're starting to have back pain or hip pain on the opposite hip. So all those things are going on ultimately because you've had a joint that has lost its space within the joint, and you've had a lot of pain on it. So part of our job is to help restore, quote unquote, normal mobility, help you to start to move in more of a normal pattern to maximize what the surgeon just provided for you with the joint replacement, okay? So what's the end goal? The end goal is hopefully 4 months, 5 months, 6 months down the road when we see you out and about, you've been able to get back to going to the gym. You're able to go out in the backyard and work for 2 hours without having extreme amount of pain in your joint. Go back to those dance classes, get back to doing those things you need to do. And that's a big part of our role, is to help you restore that movement that you have been lacking for however long it's been. So that's the main focus with our role with your care. I think our next slide is going to go over to Shannon here. She's an occupational therapist.
And one of our primary focuses is all those daily tasks: dressing, bathing, going to the bathroom, especially if you have any kind of precautions or restrictions after your surgeries, or you may not be able to bend down and just get your shoe back on or your sock. So we talk about some tools that might help you out. Typically these tools are not covered by insurance companies, so we give you some resources to where you can get those items maybe at a better deal. And then we also discuss getting into the small walk-in shower that may not fit a shower chair, having to step over that dreaded tub, and maybe some equipment that can help out with that as well. And then also we promote independence, so we want you to get back to doing those things, not primarily just having your spouse do everything for you. And we also look at extra activities such as cooking and cleaning and laundry, all those other things that you're doing. And if you've got precautions, how are you going to get your laundry out, you know, if you can't bend, things like that. So our primary focus is to try to make you as independent in all your daily tasks.
And David was saying that usually about 2 to 3 days. Actually, it's getting even shorter. We're anticipating very soon people will be having same day total hip, total knees. Some of our shoulders now are going home same day. I know. I was like, what? But it's really exciting, and they're going home safely. So just put that in your little bonnet. You can anticipate after you go home that you will be receiving a phone call from a registered RN within about 24, 48 hours. We want a safety net for you because your surgeon's appointment usually isn't for about 2 weeks. So they're going to be asking you things like, how are you doing with your pain? Do you understand your medicines? Are you having trouble with going to the bathroom or eating? So what we really try to say is take the phone call. We want to help you so that if there are any concerns, we can direct you, and so that you're not kind of left wondering, what do I do with this? We really absolutely, you will have regular follow-ups with your surgeon, and we want you to do those. You'll go to the 6 week, and most people go to about the 3 month, but they kind of forget they're feeling so good at the year that sometimes you just kind of forget a year's gone past. Even though you're feeling wonderful on the outside, it's a real important thing to be following back and making sure that you're doing well on the inside. We want to catch things sooner than later. And it's, I think, a really great celebration to have with your surgeon at that point. Most of our patients do have outpatient therapy. Most of our patients go home with outpatient therapy, 91%. And that's pretty exciting for us. On average, nationally, about 55% are going home from the hospital. Where are they going? They're going to inpatient rehab, skilled nursing facilities. We want to get you home as soon as possible. We find that our patients are safer there. And the other thing is you've just gotten your new bionic leg or your knee or shoulder, but honestly, we've done all that we can on our end to help you really have those best outcomes. That's going to be up to you to take really great care of it. I'll let you know that we are working specifically on that length of stay. We're working on getting you home sooner than later. We're really excited now that about 85% of our patients are having their physical therapy day of surgery. The only barrier that we've found is if they come back really late, sometimes our physical therapists have to go home. So the nurses are helping with that. Really improving our class attendance. We have about 75% of our patients now able to attend class. Anesthesia have been our champions. Our patients a year ago, 80 to 90%, or 70 to 90%, or 70 to 80% of our patients were having general anesthesia. Now it's less than a third because of the great work that they're doing. And that's why we're able to get up and moving and get you home sooner and safer. Our pain score, this one is what gets me jazzed because what we are looking at is what is the average highest pain score, not your average pain score. What's the highest pain score our patients are experiencing? And again, this is an average, some a little higher, some a little lower. What we've found is we've really been able to bring that down so that when you go home, our goal as nurses, pretty gold standards, we want to keep you 4 or less. On average, our patients are going home easily 4 or less for knees and shoulders here. This, and bottom line, what just gets me really, really thrilled about doing this job and working with this team is in 2014, of our surveyed patients, over 95% said that they would rate their overall experience of care, which includes their surgeons, the nurses, and the hospital, as excellent. And 99.6 would recommend us to their family and friends, to their loved ones. So we're pretty excited about that. We were 100% for a while, but we'll keep working at that, getting that back up. Okay. So again, who is Kadlec Joint Care? You know, basically, we just really want you to know that we're here for your safety. We're here for your comfort. We're here for your best outcomes. And we really want to collaborate and benchmark with the best and to continually improve and feel absolutely in my heart, you deserve to know. You deserve to know the care that you're going to receive and what questions to ask about that. So, okay.